I worked as a health educator for the WIC program, so the Women, Infants, and Children program, and I also worked for the Perinatal Services Program, CPSP program, Comprehensive Perinatal Services Program for women who are on Medi-Cal. Growing up, I went to the hospital and to the clinics with my dad a lot. He was sick a lot, and so I would go and interpret for him. And a lot of that times that we went, we had the experiences weren't that great. My dad was, I guess because he didn't have an education, people didn't treat him very respectfully. When one of my clients came in and she was crying, she was really upset that she was treated poorly at the clinic, and I thought, well, this is something I can totally do. I can totally become a physician assistant. My boss had told me, oh, you can teach people to. You can teach them to diagnose, you can teach them to treat, but you can't teach somebody to be nice. 2 years from now, I would hope that I'm working in an underserved community, because that's why I came here in the first place. I want to give back to the communities that have just given so much to me growing up. We are getting educated with the nurse practitioners, and I don't think that in the whole U.S., I don't think there's any other program where nurse practitioners and physician assistants are being educated together. They're integrating new concepts into teaching, team-based learning. That's a new concept that they're integrating here that we're doing a lot more with this cohort compared to previous years before. And that's something that will be invaluable in the future when you're working in a professional setting, because you will be working in teams. I think this is the best time to be in healthcare because of all the changes that are going on. I was just telling my classmate the other day, we are that group that's going to make the change.